Welcome to UNICEF Activate Talk, hosted by UNICEF Ghana. We have people viewing us from all over the world. It's 2 p.m. here in Accra, and I know we all know that. Let's say good morning to those in New York. Can we all say good morning?
Good morning.
And in the Middle East is afternoon. Can we say good afternoon?
Good afternoon.
And all the way in Bangkok, it's evening. Can we say good evening?
Good evening.
Very good and very well. Thank you very much for your participation. So UNICEF declared the year 2014 the year of innovation for equity. Now our theme for today's discussion is building virtual bridges, innovative solutions for reaching the unreached. We'll be having talks from 4 presenters. The 4 people would definitely tell us about their innovations and how they are impacting our societies and how they are changing lives of people. So, without much ado, I would say enough of my talks. Let's plunge straight into the conversation for today.
Honorable Deputy Minister of Gender, Children and Social Protection, representatives from ministries, the media, distinguished invited guests, dear viewers online, good afternoon and welcome. The year 1989 saw many firsts. 25 years ago, the world's first text message was sent. The first commercial internet service providers surfaced that year. Other novelties in 1989 were even more outstanding. People all around the world stood up for their rights with renewed vigor. In South Africa, 100,000 people gathered together in Cape Town for a peace march to demand civil liberties. In Europe, the Berlin Wall collapsed, reuniting a formerly divided country. Many free elections were held around the globe for the first time, from Brazil to Poland. Citizens stood up and demanded freedom and the right to express themselves. In 1989, world leaders also decided that the rights of children needed special care and protection. The leaders wanted to make sure that the world recognized that people under 18 years have human rights too. The Convention on the Rights of the Child is the first legally binding international instrument to incorporate a full range of human rights, including civil, cultural, economic, political, and social rights. It enshrines children's rights to survival, to develop to the fullest, to protection from harmful influences, abuse, and exploitation, and to participate fully in family, cultural, and social life. The UN General Assembly adopted a convention on 20 November 1989, 25 years ago this month. Since then, we have come a long way. Great progress has been achieved since the convention was adopted. Far fewer children now die before their 5th birthday than 25 years ago. More children are going to school, and more have access to clean drinking water. However, in spite of the overall gains, there are many children who have fallen even further behind. All challenges have combined with new problems to deprive many children of their rights and the benefits of development. To meet these challenges and to reach those children who are hardest to reach, we need new ways of thinking and new ways of doing for adults and for children. I am therefore pleased that today we get a chance to listen and interact with 4 change makers who have developed or embraced new ways of doing things, tackling some of the toughest challenges in reaching those hardest to reach. Getting life-saving health information into the hands of rural mothers who may be illiterate, quickly providing cash support to the poorest of the poor, and a tool for providing policymakers with critical information to manage our schools better. All of the innovations featured today contribute to bringing knowledge and services closer to the people who are often deprived of them because of where they were born, where they live, and what they can afford. They help us bridge the divide to realize the rights of every woman and every child. I will conclude by welcoming you all to this afternoon's energizing talk show event, and I look forward to an interesting afternoon of new insights and lively interaction. Thank you all very much.
I would like to welcome the Honorable Deputy Minister for Gender, Children and Social Protection, Honorable John Alexander Akon.
UNICEF Country Representative Susan, representatives from the government of Ghana, viewers online, invited guests, ladies and gentlemen. I am glad to be here this afternoon to participate in the UNICEF Activate Talk. And I would like to take this opportunity to congratulate UNICEF for their relentless effort in protecting and promoting the rights of children. As Ghanaians, we are proud that our country was the first to ratify the Convention on the Rights of the Child on 5th February 1990. This unprecedented acceptance of the convention clearly shows Ghana's commitment to advancing the rights of children. As the UNICEF rep said, remarkable progress has been achieved since then. In 1998, only 40% of births were attended to by a trained doctor, nurse, or a midwife. Today, this rate stands at 70%. The under 5 mortality rate for Ghana has reduced from 155 deaths per 1,000 live births at the time when the CRC, Convention on the Rights of Children, was signed, to an estimated 72 deaths per 1,000 live births. Again, this shows that considerable progress has been made over the past 25 years. At the time the Convention on the Rights of the Child was signed, half of the population lived in poverty. As of last year, we have managed to cut this figure by half. Ghana is on track to achieving ahead of time the Millennium Development Goal 1 target of reducing by half the proportion of people living in extreme poverty at the national, urban, and rural areas. There is so much to celebrate, from declining infant mortality to rising school enrollment. But this historic milestone must serve as an urgent reminder that much still remains to be done. We are glad to be working with UNICEF and its partners to take on some of these remaining challenges. To do this, we need to be more ambitious and focused. We need simple, innovative solutions to help us reach those who are still excluded. One of the innovations I would love to talk about today is LEAP, the Livelihood Empowerment Against Poverty Program. Since its launch in 2008, this social cash transfer scheme has become Ghana's flagship program of the National Social Protection Strategy and a key instrument in the government's fight against poverty and inequality. In the year 2014, LEAP reached around 76,913 families in 103 districts in all the 10 regions of Ghana. With the help of LEAP, children from the poorest families in Ghana can now go to school. They are less likely to drop out or miss days of classes because of poverty. These children have grown healthier because LEAP gives them access to free health insurance. They are therefore less likely to miss out on going to the clinic when they are sick because of poverty. Today, we are excited that more and more individuals and organizations are using new ideas and technologies to help us tackle critical challenges to our development more effectively. Evidence shows that these innovations make a real difference in the lives of children and women in Ghana. Let me therefore congratulate the 4 presenters today who will be doing it for the promising work they have done so far. And I would like to encourage the many innovators out there in Ghana and elsewhere to continue their important efforts to help us find effective solutions to giving people access to health care, education, clean water, and safe and fulfilled lives. I thank you so much for the opportunity.
Now to the main reason why we are here. Let me remind those watching us via talks.unicef.org that if you want to interact with our presenters today, all you have to do is to go on Twitter and use the hashtag UNICEFActivate. UNICEFActivate. Without further ado, I would want to now open the podium to our 4 presenters who would now come and talk about their innovations. The very first one, representing TechMed, is the team leader, Samuel Jijonu. Let's welcome Samuel.
Good afternoon. How are you all feeling?
Good.
Great. Once again, my name is Samuel. I'm from a company called TechMed, a leading software consulting firm that seeks to build scalable web and mobile applications for sustainable development. Now, this afternoon, I'm very excited to share with you all one of the timeliest technological interventions in Ghana's education sector, the mobile school report card. But before that, just a background. Watching these excited kids reminds me of myself. It reminds me of about 24 years ago when I was born. Now, just like every growing child, I had aspirations. Now, as a young adult, I've come to appreciate the fact that oftentimes in life, we're not the only determinants of who we choose to become. And as much as I won't attempt to list all of these determinants, I can at least make mention of one, and that's education. But more importantly, the efficient monitoring of the quality of this education. In Ghana, currently, availability or access to accurate and up-to-date information on schools remains a big challenge. And this goes a long way to hindering evidence-based planning for better quality of education. To intervene, the Ghana education sector, or the Ghana Education Service, deployed the manual school report card to help collect relevant school information based on these 6 important checklists. So the checklists cover information on students or pupils, teachers, and then overall school management. But its inefficiency lay in the process. So let me just quickly walk you through. Back then, the paper forms had to be filled out by data collectors, and these data collectors can be head teachers or circuit supervisors. Then afterwards, these paper forms are collected, stored, collated, and manually analyzed by districts, regional, and national level administrators. So obviously, this made data retrieval, reporting, analysis, and quality control extremely difficult. Why? Because substantive amount of time and resources were required to go through this manual process. The good news is the Ghana Education Service, in collaboration with UNICEF and TechMed and other development partners, saw the need to leverage ICT to help intervene. And so this afternoon, I'm excited to share with you all the outcome of these discussions, Ghana's Mobile School Report Card, MSRC. So what is the MSRC? The MSRC is an easy-to-use web and mobile application designed to enhance school-related data collection, analysis, and reporting. This solution has 3 major components. There is a web application for actual data collection. There is a web portal for analysis, reporting, and administrative use. And of course, a handset integration to facilitate data transmission between these 2 modules. I'd love to quickly walk you through some of the major functionalities underlying this application and hence its benefits. So first of all, to ensure efficient data analysis or quality control, both head teachers and circuit supervisors are allowed to submit data on same education indicators. You may ask why. So this goes a long way to helping stakeholders to identify early discrepancies and urgent concerns in order to make timely interventions. Now again, considering the instability of internet connection, especially in remote parts of the country, the application has been built to be able to store data locally when there is no internet in order to make automated submissions when internet connection is detected. Now, again, the application has an inbuilt geolocation utility that allows the stakeholders to be able to ascertain its source and hence credibility of the incoming information. And finally, the MSRC application goes a long way to engage in the community by allowing its members to either report or seek relevant information on schools via SMS or text messages. So in essence, Ghana's Mobile School Report Card is helping create sustainable change in three main ways. So first of all, it's helping to save time, money, and resources spent on the manual data collection methodologies, if you will. The MSRC also goes a long way to creating that convenience of reliable and secure data on schools, thereby helping stakeholders to be able to generate real-time reports for further analysis. This is to say that Ghana's mobile school report card is streamlining the flow of relevant school information from circuit level through to the national level in order to enhance decision-making, planning, and then implementation. To conclude, I would love to engage you all in a series of what-ifs. What if every child, every growing child, went to school not doubting the availability of their teachers? What if every child went to school not affected by the inexhaustive coverage of the teaching curriculum? What if every child went to school not demotivated by the insufficiency of teaching and learning aids? Then I believe one thing will happen. Each growing child will build a conviction that will bridge the gap between the status quo and their aspirations. And so, as an innovation, you would all agree with me that Ghana's mobile school report card is indeed one of such virtual bridges. Thank you very much.
So our next presentation is coming from a group called Literacy Bridge. Literacy Bridge is actually a non-profit organization based in Ghana, but operating from the northern region, especially. Andy would be talking on their product, which is called the Talking Book Technology. Andrew happens to be the technology ICT manager and a pioneering member of this project. And without much ado, let's invite Andrew Bayo.
Good afternoon, good morning, and good evening to other listeners listening to us online from across the world. My name is Andy, and we're just going to talk about an innovative technology called the Talking Book. Knowledge saves a life. Knowledge saves a life when a poor mother in a rural community knows that her daughter is suffering from diarrhea and needs to give her oral rehydration therapy as first aid as she finds ways to get the child to the nearest health facility for further treatment. Knowledge saves a life when a rural folk knows that he needs to get under a bed net to protect himself from mosquito bites and consequently from malaria. That knowledge is not far-fetched from all of us seated here. We just flip out our mobile phones, our tablets, and we are on Google, and we have everything. For the other world's 1 billion people, this is really an issue because they don't have the privilege we have. They don't have internet connection, they don't have mobile phones, and they live in rural, hard-to-reach places. And is this 1 billion people our organization, and in fact, myself, we are very concerned about? This 1 billion people don't have access to this knowledge, and they badly need this knowledge to be able to improve upon their livelihood. And interestingly, when they don't have this knowledge, this is what happens. The bed net that is supposed to be protecting the child and the mother from getting infected by malaria ends up in the farm, protecting tomato seedlings. That is lack of knowledge. A farmer tries to do mixed cropping, and he doesn't know that there are some batch of crops you need to combine together to make that mixed cropping work. He doesn't know the required spacing to give his crops to have adequate harvest. That is lack of knowledge. A lot of organizations provide funding for so many things, but without an educational component of it, it's not as effective. And this is where we come in. We try to bridge the literacy gaps, the access to information gaps between the rural people who really matter and those of us that are privileged to be sitting here. The people we work with are people that live in the most hard-to-reach places in the world. There are people that live under $1 a day. There are people that have no electricity in their communities. There are people that have no mobile phone service in their communities. These are people who still believe that when a little child dies out of malaria, it's caused by a witch, and maybe an old lady gets busted and kicked out of the community. These are the people that we are very interested in, and these are the people that our technology reaches out to. How do we do this? We do this through this magical device called the Talking Book. The Talking Book is an affordable audio digital computer that I have been working with to develop in rural Ghana, northern rural Ghana, for the past 7 years. It's a computer that is designed locally for rural people, and it was designed through what we call participatory user design methodology. So this device can be used by anybody without any form of literacy. You don't need to be educated. You don't need to have any form of literacy to be able to use the device. It speaks to you and guides you through audio prompts for you to navigate around it and listen to content of your choice. The content could be in health, agriculture, literacy, human rights, whatever content that can go into an audio format, we can design it and put in there for our rural folks to listen to. It is very interactive because it allows you, the user, the rural user, to also have a voice. You are able to speak into the device and record your voices about messages that you are listening to. You might want to ask for some other messages that might not be there, or you want to comment on some messages that you have heard and need further interpretation to understanding them. The device itself doesn't need any sophistication. You don't need to have mobile coverage, and it uses just local batteries that are readily available for everybody to buy in all rural communities. So that's our device, that's our technology we came out with to break this gap and help our brothers and sisters that are in the rural world. But how are they using this in the communities? Is there anybody from Northern Ghana here? Maybe from Upper West? Or? Yes, good. So from Northern Ghana. So you will know that up north, where I have lived all my life and I'm doing this project on, we sit around a bowl of TZ in the evening, maybe 10 or more people, and have our diet. After we have our meal, we will definitely talk. So communities are using this device after those times to listen to some episodes from the Talking Book and then discuss them. If they have concerns, they record their voices in there, and then we have that feedback. We are able to analyze that feedback and know what they are listening to, how many hours they are listening to it, how many minutes they are listening to it, and we are able to improve our program based on that. Farmers are using this. It's an access to knowledge tool. And once it's an access to knowledge tool, anything that you need to go in there, we can package it and customize it and localize it to meet your demands. Farmers are using this, and we are working with the Ministry of Food and Agriculture to design messages for rural farmers to learn from, because they are hard to reach, and the extension services are finding it difficult to reach all these people. So we have agri messages in here, and of course, we all know that in the rural world, most of them are subsistence farmers. So they listen to health messages, human rights messages, and then of course also listen to messages that can improve their agriculture. This is just a typical use of the Talking Book. You can see the farmers there. Right now in Northern Ghana, they are uprooting groundnuts and plucking them. So they are plucking their groundnuts and listening to messages on the Talking Book created by MOFA in partnership with us. And the messages they are listening to is on how to be able to dry the groundnuts and store them so that they can be safe in the next farming season. This is one of the most touching pictures that I've ever taken. So the two ladies you see in the slide there are traditional birth attendants. These are people here that will deliver ladies or women who are in rural communities. Now that has changed. They want every single mother to be able to deliver in the health facility. So the messages they are listening that we created in collaboration with Ghana Health Service are messages telling them not to try to deliver women at home. Their messages are telling them the procedures they have to follow to bring women that are in labor safely to the hospital so that they can deliver there and have proper people attend to them. But how do we create our content? Our content is the most important thing, because we can all speak to people, but you need to understand how you can speak to people to change a behavior. Everybody wants to change, but it's not always easy to change. And with technology, it's very difficult for people to adapt. Well, we have been doing this for a very long time, and we are experts in this. And every single process of our activities is research-based. We do formative research to find out whether the message we are going to deliver, we should make it in the form of a song, or whether the message we are going to deliver, we should make it in the form of a drama, or the message we are going to deliver should be with an expert in health, an expert in agriculture, to deliver the message. Whether the message needs an endorsement from an opinion leader in the community to just authenticate it. Whether the message needs to be a story that somebody relays and people adapt to it. We have been doing all these things, and then we use our how and why tools to be able to do this. We just don't talk to people and tell them what to do, but we use formative research methods to be able to get people to adapt to what we are telling them to do. So specifically with UNICEF, these are the 6 strategic areas we are working on with them. And we have messages on all these 6 in communities that women and children are listening to and then improving their lives with them. Talking about how far we have come, what has brought us here today. We started all this in 2009 when we first piloted our project, and we reached about 1,000 people. Today, we are happy to be reaching about 40,000 people with over 5 million minutes of messages. And we are also happy to report that with our UNICEF project that is ongoing, approximately 80% of our women that we are reaching out to are reporting behavioral change. They are changing their ways that they used to, how they used to do things, listening to the messages that we have delivered to them. Well, Ghana is not an island in the world. It's not only in northern Ghana or in Africa that there is poverty. There is rife poverty in Asia. There is rife poverty in South America. And today, in this digital age, we at Literacy Bridge, we don't see a reason why somebody should not have access to education, access to information that can improve a person's life. We don't see the reason why a woman should not have access to be able to reach out to their children and then explain how they can adapt things that can tend to their life. So reach us, anybody that wants to contact us, hit us online at literacybridge.org. If you have a project that is interesting across the world, please speak to us and then we can see how this works. We want every single person to have life-saving information that can improve their lives. Thank you very much for your audience.
Thank you very much, Andy. I would go right ahead and invite Jigbodi Agbeponu from the Ministry of Gender, Children and Social Protection to talk about their new innovation, which is the LEAP program. I believe the minister mentioned the LEAP program and talked a little bit about it. Jigbodi would give us a deeper insight.
My name is Jigbodi from the Ministry of Gender, Children and Social Protection. My duty this afternoon in the next few minutes is to share with you what the Livelihood Empowerment Against Poverty program is, to also share with you the progress of the program over the years, the impact it has made in the life of the poor, and also to share with you how we are leveraging on technology to deliver this program. What is the Livelihood Empowerment Against Poverty program? LEAP, for short, is a cash transfer program that is targeted at the extremely poor people in 3 categories. To qualify for the Livelihood Empowerment program, you must first of all be an extremely poor person, and that level of poverty is objectively determined by a scoring questionnaire called the proxy mean test. Once you meet that threshold, you must belong to one of the following 3 categories. First, you must be an orphan and vulnerable child. As you can see on the slide, the child behind the woman is an orphan and a vulnerable child. And once he meets the poverty threshold and he is an orphan and a vulnerable child, he qualifies for the program. Now, being on the program, this child is also expected to meet certain conditions. First, a child of her age, you have to send her to school and make sure that she attends school. She must also be taken to the healthcare center for immunization and other healthcare issues. The next category is what you can see is an elderly person. You have to be 65 years and above to qualify. So you see an elderly person there waiting in a queue for his LEAP grant. The next category is a severely disabled person without any productive capacity. The elderly person on the screen is blind and cannot see, therefore has no productive capacity. So once he meets the threshold of poverty, he is qualified to be on this program. Now, what progress has this program made over the years from the year 2008 till now? In the year 2008, when the program started, it started in 21 districts with 1,645 beneficiary households. In the year 2014, as my honorable minister said, we have almost 77,000 beneficiary households. But by the end of 31st December, this number is going to increase to 100,000 because we are processing data to up it to 100,000. The target for December 2015 is 200,000 beneficiary households. There is statistic that we have over 880,000 extremely poor households in the country. So this is the progress the LEAP program has made over these years. Now, what is the impact of LEAP on the life of the extremely poor? The University of Ghana and the University of the North Carolina University in the US conducted an impact assessment on the LEAP program. And they've found out that the LEAP program is really impacting on the extremely poor. But I will just share with you 4 of the impact. Now, one of the key impacts was that the LEAP program impacted positively on the local economy, because they've realized that for every 1 Ghana cedi injected into the local economy, there is a multiplier of 2.5 Ghana cedis. So every 1 Ghana cedis injected into the local economy generates 2.5 Ghana cedis. They've also realized that for children who must be made to go to school because they are beneficiary of this program, because of the LEAP program, school attendance in those communities, both basic and secondary school attendance, has improved dramatically. Now, when you are on this LEAP program, because you are an extremely poor person, you are also linked to the National Health Insurance Scheme, and you don't pay anything before you get onto the program. When it expires, it is renewed. So they've also found out that all LEAP 90% of LEAP beneficiaries are also linked to the National Health Insurance Program. So LEAP is also helping to improve access to health care in Ghana. And they have also found out that LEAP is impacting positively on productivity in these small households as well. There are a lot of results from the impact, but I just want to share with you these 4. Now, how do we deliver cash to these beneficiaries? The cash is delivered through a manual means where the Ministry of Gender, Children and Social Protection get the cash to a service provider, Ghana Post. They carry this cash physically and go to over 20,000 communities to pay these beneficiaries. And you and I know that delivering cash manually comes with a lot of risk. So we decided to leverage on electronic payment technologies that are existing in this country to make sure that the challenges that are with the manual cash system are overcome. So we have piloted electronic payment mechanisms from 3 service providers, namely MTN, Aya Technologies, and Gibbs, the eSwitch platform. Now, what are the challenges with the manual system? The first challenge is that there is a high risk and the possibility of fund leakages. The second one is that once the manual payment service provider comes and you are not at the pay point to receive your money and it's gone, that is it. You can't get access to your cash grant, and that defeats the objectives of the program. There's also the issue of long waiting time in queue. So the electronic payment mechanism is to overcome these challenges. So the MTN, as you can see a LEAP beneficiary receiving his cash grant from an MTN merchant. You can also see a LEAP beneficiary here receiving his cash grant from the eSwitch platform. One good thing about the eSwitch platform is that the beneficiary is biometrically identified with a fingerprint. So if it is not that beneficiary, you will not be able to get your money. So it makes it very secure. Now, this pilot we have done has proved to be very successful. we have realized that the opportunity for fund leakages have reduced drastically. We have also realized that the waiting time in queue has also dramatically reduced. There are times when you are going to do monitoring of payment and you don't set off early, because by the time you go, you realize that payment is done, because it is an electronic means, it moves faster. Now, also, one critical issue is that the LEAP beneficiaries can't do this cash out at their convenience. If you are not there and the payment service providers come and they go, you can go to any service provider or any agent of the service provider in your community and you cash out at your convenience. So the electronic payment mechanism has been very successful. Now, what is the way forward? In conclusion, I'd want to say that cash transfer programs work. The LEAP, as the impact assessment found out, works because you cannot teach a hungry man how to fish. And as far as the LEAP program is concerned, electronic payment is the future of cash delivery in Ghana. And in the year 2015, we are going to replicate this pilot across all the over 20,000 communities across the country. Thank you very much.
For our final presentation, we would be calling on Voto Mobile. Voto Mobile is a social enterprise based here in Ghana. On behalf of Voto Mobile, I invite the Regional Director for West Africa, Perlin Budu.
Can I ask all of you to please stand with me for just a few seconds? If you're able to stand, just stand with me for a second. I could see a couple of people dozing off, so this is just to wake up. Now, if you do not own a mobile phone, please remain standing. If you don't own a mobile phone, please stand. Anybody? Okay, there's nobody left. Oh, there's one person. You don't own a mobile phone? No. Great. So actually, this is statistically significant, our research that we've done right here, because 1%, I would say there's about close to 100 of us in here, and one person does not have a mobile phone. That leaves us with 99% of the population with a mobile phone. This is great news, because I would like to introduce you to a technology today that harnesses on this pattern throughout the world, and even throughout the developing world. I'd like to introduce you today to Voto Mobile. And our mission is really to amplify the voice of the underheard and to provide easy access to life-changing information for people all over the world, and specifically for women and children. Our journey began when our co-founders were actually conducting some research in the north of Ghana, and they met women like Humu, who at 6 months pregnant, she was desperately looking for information that would help her to have a healthy pregnancy and delivery. Meanwhile, a few miles away in the health clinic, the workers are desperately looking for ways to connect with women like Humu. Statistically, women who live further away from the clinic are less likely to have a chance of a healthy pregnancy and delivery, and have a higher percentage of maternal mortality. Humu is not the only one in this situation. Across the world, there are a total of about 3 billion people who are disconnected from important information from products, services, and decision makers through no fault of their own, but through barriers that we have identified, such as distance, language, literacy level, and infrastructure. We are basically looking for a way to connect those communities with the information that they so desperately need. And so as a result, we came up with a platform that harnesses on mobile technology to meet that need. We first came up with an SMS platform, and we found that that didn't actually reach the most marginalized people that we were targeting. We found that the most people who were interacting with our system were male, and they were primarily based in urban areas. And so we went back to the drawing board. We changed our platform and made it a voice-based system. When we changed our system, we realized that there was a complete turnaround. The people that we were interacting with increased by tenfold. And in addition, we had more participation from women and people in rural areas. This was huge information for us. We found that with voice, we're also able to better create a trust relationship between the organizations we were working with and the communities we're working with. And additionally, we're able to consistently adapt our technology. One of the projects we worked on was directly related to Humu and the community that we came into touch with in the beginning. We have 6,000 women currently signed up to receive maternal health information based on a 10-month curriculum. Every week, the pregnant woman gets information that's specific to that week of her pregnancy that guides her through the activities that she should be partaking in order to make sure she has a healthy pregnancy. We're also able, because this is phone-based, to quickly adapt and change our methodology. So we try different tests out. For example, do the women prefer to hear a male voice or a female voice when they receive the call? Would they prefer to hear from an experienced healthcare professional or from somebody who is respected in the community, who's known to have had several pregnancies that are successful and can share her experience with those women? As a result of these tests, we're able to increase consumption of the content from 55% to 80%, which we're really happy with. We've also worked in partnership with UNICEF and Innovations for Poverty Action on a behavioral change campaign. And we were looking to increase the positive behaviors such as use of mosquito nets, exclusive breastfeeding, and use of ORS rehydration salts. We've actually had more than 1,650 people subscribe to our service in 5 various local languages. And so far, our calls have been answered over 42,000 times. What this means is that each subscriber, we only have about 1,650 people on this particular program, each subscriber has listened to messages approximately 25 times. What that means is that they're listening to different messages. They're repeating the messages. They're asking for the messages to repeat it so that they can let their children and their wives and their family listen to these messages. They're also calling in with their own mobile credits to hear these messages again, as the community considers these messages very important. This is just the beginning. We have dreams for the future. Many of you are familiar with Khan Academy, which is a video-based educational website which provides simple education for people through the internet. We would like to have a mobile version of this for school children, which we think would be really interesting and would particularly be relevant for communities, for example, in Liberia, where schools have been closed down because of the Ebola outbreak. We could have testing systems where we could have quizzes over the phone instantly as people get the information. We can award points based on people's performance, and additionally, we can even give real-life rewards, such as airtime bonus credits that are sent directly to the participants' phones. We're also able to get feedback from citizens. So right now, we have instigated 4 panels in different communities of 300 people each, and we've purposefully included people who are traditionally marginalized and don't have their voices heard. So we've included disabled people or physically challenged people. We've included women, and we've included elderly people who are traditionally not involved in the decision-making process. What this means is that we're able to collect this information and share it with the local government authorities onto what people think the development priorities should be. This is really groundbreaking information, and it really creates a new stage for government advocacy and accountability. So far, we've partnered with various organizations all over the world. We've done projects in Brazil, in Afghanistan, in Nigeria, and many, many countries. We've been in existence for just about 2 years now, and we're based here in Ghana. We've just recently opened up an office in Zimbabwe, and we have a presence in Canada and the US as well. We've done projects in over 20 countries, and so far our projects have connected with over 250,000 people, and we believe we can reach even more people as time goes on. Our vision is really a world where the 3 billion poorest people are directly connected through our platform with institutions, with NGOs, and with decision makers and business people as well. We believe that Voto is a platform that can be used to do this, and we really are looking for new partnerships. We're looking for new ideas and new innovations on how we can work together to make sure that people's voices are heard. So the story began with Humu, and we're also ending with Humu because at the end of the day, there's so much more that we could do with this platform. People like Humu and 3 billion other individuals are looking forward to receiving vital information and participating in decision making across the world. Thank you so much for your attention.
Thank you very much, Pearl, for that insightful presentation. Now that we've all heard what they have to say, I'm sure we have questions and we have queries and we have contributions and advice for them as well. The questions are already trooping in on Twitter. Let's start with the very first question that came in from Twitter, and then I would come to the audience, so you guys should start preparing your questions for them. The very first question goes to Jigbodi Agwepono. And the question is there any empirical evidence of the impact of the LEAP grant on child labor?
As I said, the impact assessment was done by the University of Ghana and the University of North Carolina. And one of the outcome of the impact assessment was that people of school-going age, go to school, they attend school, then I can say that, inferring from that, it has impact on child labor. Even though child labor wasn't mentioned directly, but once people go to school, they wouldn't participate in child labor. And
any questions from the audience? You have a question. Can we get the microphone to him, please?
Do we consider the household size before dispersing the money? And how much is given to each household? Then the second question is, what is the plan with the LEAP regarding the fiscally challenged people on the street? Then on voto, can I continue?
Yes, go ahead.
Now, we know in most rural areas there is no light, though they could have mobile phones, and if you have no light, they can charge their mobile phones. What is the impact of the lack of both recharge card and electricity on the usage of mobile phone to the success of your intervention? And you told us the participatory approach you use, and you've mentioned the specific people or the stakeholders involved, but children aren't involved. Yet in children, like in today's children, they want to be involved because they have opinion on how they can be treated so they could be happy. What do you think could be done to get children participate in making their opinions heard as part of your intervention? Thank you very much.
The answer to the first question is yes, the size of the household does count in determining the amount of grant that goes to the household. If you have a one-member household, the grant is 24 Ghana cedis. A two-member household, it is 30 Ghana cedis. A three-member household is 36, and 4 and above is 45. And these grants are paid every 2 months. As well. Now, going back to the issue of the physically challenged on the street, in my presentation, I did mention that we have a qualifying criteria to be met before you can be put on the LEAP program. The first one is that you must be extremely poor, and this level of poverty is objectively determined. You use a questionnaire called the Proxy test to collect data, and once the data is collected, they have a software that ranks it. Once you meet that level of poverty, then the other 3 categories: are you an orphan and a vulnerable child? Are you a severely disabled person without productive capacity? So, if you are physically challenged, and you have productive capacity, that certainly means that you are disqualified from being on the program. So these are the criteria. Once you meet these criteria, you are enrolled onto the program. So
I'm going to quickly address your question while I have the microphone. And so your question was, what are the challenges? How do we overcome the challenge of communities where they do not have mobile phones or they don't have this tool? Firstly, with the power issue, we found that some communities that we work with, even though they may not have consistent access to electricity through the main line, they found different ways to charge their phones and to remain connected. There are people out there who are charging mobile phones using car batteries. There are people that actually charge, this is their business. People come to them and pay them money so that they can charge their mobile phones. And people find a way to work. They find a way to stay in touch with their friends and family no matter what. We found that some of the people that we interacted with were not able to afford to pay their hospital bills or to pay for their the school fees for their children, but they will still buy a mobile phone and make sure that if they need to talk to somebody, they can at least flash or find a way to reach out to people. So this is really important to note. People have found a way to make it work. There's some communities that are currently not connected and not able to get reception, and I think that's increasingly that's reducing very quickly. So that's something that we're excited about. We're looking for cooperation from the telecommunication industry as well in order to make sure that we're able to reach a lot more people. With regards to children, I think that's a really good point that you make when it comes to interacting with children. And many times the phone that is owned in the family is not belonging necessarily to an individual, but everybody in the family uses that phone. So if somebody needs to make a call, they would borrow the family phone and make that call. Children are able to listen in on some of the conversations based on the parental guidance. And when we've educated these communities that we're doing a program that's specifically for a group of people, so children, for example, for teenagers, and we're able to actually connect with them that way. We also have some programs that interact directly with children through schools. So we have some ambassadors in schools, some teenagers that are ambassadors for that particular program that actually act as peer educators for their colleagues and for other people within the community as well. So it's something that's consistently changing, and if you have ideas for us, we'll be happy to talk to you.
Thank you very much, Belle. I'm going to ask a very generic question, which I think everybody needs to address over here. Introducing innovative ideas means introducing change, right? Oftentimes, these meet resistance. What are some of the challenges you have met along the process, and how did you surmount them?
Thank you. So I think that to begin with, we have tried to leverage off a platform that is already a habit former for people. So people are already using mobile phones. So we didn't try to change that. People are paying very close to attention to the voice calls that they get. We found out from our research that some of the people that we interacted with are not literate, and so even when an SMS comes through, they might not be able to read it. They might have to wait until somebody who can read comes into the household and is able to interpret that message for them. So we leveraged off the idea that people are already using mobile phones. People are paying close attention to the voice calls that they received and harnessed into that trend that we observed. That way, we're not exactly asking people to change too much what they do, but it's just a slight shift away from what they're used to. And we found that this works particularly well in communities with low literacy rates and even across the board in urban areas as well. We've had significant success with that, and as I said, we're always learning to improve more.
Great. Thank you. So I'll be very, very succinct. To answer your question, I'll say that we didn't wait to experience these challenges. We actually anticipated them. What do I mean? So first of all, it was a problem, but it was more of a concept. So before even actually starting to code, to actually build the application, we went for feasibility studies. We went to Savalugu, Nantong, and other remote parts of the country, because they are the intended users, okay? And so we met with the district statisticians. We talked to the local Ghana Education Service officers. We met with the head teachers. We talked to the circuit supervisors. And so actually, these stakeholders are the ones that built the application. We just used technology to translate that thought to reality. Because of course, we believe that it's very easy to change the tire of a car when it's standing than when it's in motion. So thank you.
Thank you, Samuel and Andy.
Yes, thank you very much. That's a very good question. I must say that technology doesn't solve all the problems. Having a pretty cool technology does not make people adapt to oral therapy or any of those things. The first problem was language. How do you disseminate this to the different languages that are across Ghana and having everybody learn from it? So we localize the language. So if you put it on, if you happen to be from
Bazoo, Wow, yani. Churu away, ane churu pie, ninsala emmaro, wobo, ane dunu gulu yilbaba.
So what we did was to localize the content to speak to you in your language and guide you around, the user interface to do this. The other important challenge that we have is the content that you have going onto this device. Do you contact the right experts to package the right information in here? Because you might be an expert, but you don't know how to package the information you have. You might be speaking to somebody directly, like you're commanding the person because you have all the wealth of knowledge. But people want to be involved in behavior change programs. So what we have done is to use what we call formative research in these communities to see what message people will listen to and adapt, even without knowing. For example, we had a drama on one of our talking book that was about women participation in community development. And we just had a simple drama that had men gather alone to decide where the next borehole was going to be drilled in the community. There was no woman there. And they ended up taking the decision that, well, everybody's wife should remember to bring water to the site where they are going to mold the rocks. And the following day, because there was no woman at the meeting, no woman turned up with water. So this was just a simple drama. And the men got there was no woman, there was no water, and they got angry. So they started arguing among themselves. Then one smart guy in their midst said, well, you didn't involve the ladies. They were not here. So how will they get the information? And the husbands refused to tell their wives at home that they should have brought water. So this is one challenge that we have gotten around it. We've seen how you can involve the user to be able to be part of that process of change, because behavior change is really a very critical thing. The other thing is that it's just not the device speaking to you and educating you as if it were the wealth of all knowledge. It also gives you an opportunity to also express yourself. If you feel that they are saying that your fowls that are dying is coccidiosis and you feel it's something different, you can explain it, and then an agric extension officer can respond to that concern in a more professional manner to help you adapt to it. So it's a two-way communication that gets them to get involved. So that's one challenge we have, but it's really a pretty interesting challenge that we are enjoying ourselves whilst working around. Thanks.
Thank you very much.
Thank you very much for the question. The essence of a pilot is to identify trouble spots and be able to deal with them before you scale up. In piloting the electronic payment, one challenge that came to the fore was that, to get illiterate people to remember their personal identification numbers for electronic payment has been a challenge we have identified. And as this Monday, myself with my team, we were engaged with one of the experts in electronic payment on cash transfer program across over in the world on how to overcome this challenge. I mean, we are trying to learn from best practices across the world. We have heard that it's been done in other jurisdictions where somebody might be illiterate, but that does not mean that the person is innumerate. You can keep numbers. So we are working seriously with the consultant to see how we can overcome this challenge. So we are happy it is a pilot, and before we go, we scale up, we would have dealt with this particular challenge. Thank you very much.
There's another question for you from Twitter, and it says, what is the waiting period for assessing someone and getting the person onto the LEAP program?
What is the waiting period? We have a plan. Just as I showed when I was doing my presentation, that each year with the target to be covered. So once that plan is approved, that okay, like for instance, in the next year, 2015, from the plan, you realize that we'll be adding additional 100,000 beneficiary household to the program. So it means that the whole of 2015, those are the people we're going to add. We use what we call the poverty data from the Ghana Statistical Service to do the allocations to the region. We use that to do the allocation to the district as well. We use that to do the allocation to the communities. So once we do that and we do the allocation objectively and equitably across all these geographical areas, I cannot say that we have this defined waiting time that this time there is a plan and we are following the plan. But we do the allocation based on poverty data from Ghana Statistical Service. Thank you.
My first question is to the first speaker. Is this something that students can also receive their report cards on their mobile phone? I didn't quite get that aspect of your system. And can parents also receive their children's, report cards, or this is just for analysis and statistical purposes?
Thank you. So actually, that's the big picture. But with a mobile school report card, it's currently only meant for the circuit supervisors and the head teachers to collect data on the schools to submit to the national level. So what's happening is, if the fundamental data collectors, being the head teachers and the circuit supervisors, don't have readily available, information, how is this information going to translate into becoming efficient, reports to be accessed by parents, and the students? And so the MSRC initiative is just starting from the basic education level, so that data can be collected on, say, teacher attendance, student enrollment, the availability of teaching and learning aids, in order to track or to monitor the quality of the education in these remote parts of the country. And so to answer your question, currently the MSRC can't deliver these reports via mobile phone, but that's the all-inclusive big picture.
And then I have another question for the talking books. Are they free to your beneficiaries? And how many Ghanaian languages do you have on your system now?
And then to talking book, I'm asking, how do you get feedback from the people? Because you mentioned during your presentation that when they have any questions, they would record it. But then how do you get that feedback from them? Thank you.
Yes, thank you very much for the questions. So, of course, we all know that as far as Ghana is concerned, Twi is the most spoken language. So we have Twi as one of the languages we have on our devices. Interestingly, we have two Twi languages. We have the Twi that is spoken around Western region, because we did a program with World Cocoa Foundation there. But in Northern Ghana, we have all the three Northern Ghanaian languages that we have on our talking book. But I must tell you that it doesn't take 3 days to create a new customized language onto our device. We need the language experts to sit with them to create the instructions that can guide a user to navigate around the talking book. Well, talking about whether they are free or not, if we were selling this in the open market, it would be as cheap as possible for everybody to be able to buy it. But just like I mentioned, buying a talking book without the right content in it is hopeless. It doesn't achieve any purpose. So we are not interested, and we are not a business. We are a non-profit organization. We care about people. We care about improving the lives of people. So we are not selling these talking books. We are using these talking books in programs that will be sustainable by the users and that will be owned by the users, so that it stays with them when our focus changes and we go to other people. So that's what we do right now. Maybe just to proceed to answer the other question my brother asked about how we get feedback. So that's pretty interesting. So what happens is that right now we are writing code to see how we can use GPRS to disseminate information into talking books, but that is still pretty a way ahead. But if you look at the talking book, there is a micro port on its side. And our model, our community models we use, is we have information in here, we record the information, edit them, and then we have them put in here. And we have just designed a simple app on any Android phone, and we have field agents in these communities where these messages are put in Dropbox. You don't need to have internet access right away, or you go to what we call a data center and get this data. and then you refresh all the talking books that are in your community. So this is done every 4 weeks because you want to be refreshing the content in the device. And whilst you are doing that, the device is smart. It will have tracked every single activity on a log file that was happening in the device. It will have tracked what you were listening to. It will track what you were saying into it. And it will give you what time and how many times you have hit the talking book, whether you stopped in between and all that. So we, after we have updated next content on you, we have the user statistics of what was happening before then that last update, and we are able to analyze on our dashboard.
The last one is to LEAP. How do your target groups get to know of your program, and how do you decide on the numbers that need to be covered in any given community? Thank you very much.
In how do we get to the beneficiaries and potential beneficiary? The implementing department is a Department of Social Welfare, which is under the Ministry of Gender, Children and Social Protection. You have a district social welfare officer in each district across the country. So we get to our beneficiaries through the district social welfare officers. They will do the mobilization of the beneficiaries. Aside that, we do communications on the national television. We use local radio stations as well. So we employ various means to get to our beneficiary. We use the gong, we use text messages and all that. We have what we also call the Community LEAP Implementation Committee. These are people, volunteers in the community who are working with us to make sure we deliver this program. And we also have the District LEAP Implementation Committee. So we use all these channels to have access to our beneficiaries.
So here are my questions, Leap. 2 questions. One, does it mean when people are accepted onto the program, they would remain forever on that program? Or what happens? When are they dropped from it? Are they reviewed after a period of time? That's the question. And then also, if someone meets all those criteria, is poor, is perhaps crippled or disabled or something, is it like 100% certainty that you be picked on the program? It's not like after a point we drop you, but is there 100% certainty that you be picked for the program?
On the issue of people who are on the program, are they on the program forever? There are various angles to this issue. The first one is that somebody who is severely disabled without any productive capacity, once the person does not have any productive capacity, certainly, such a person, you cannot take him off the program at any time. So such a person must be on the program. And you are talking about an elderly person who is above 65 years and extremely poor. But for the other ones as well, what we do is that there's what we call complementary services for the beneficiaries that are on the LEAP program. We try to link them to other complementary services. And also, as I sit here, we are in the process of designing what we call a graduation model to help those people who would have who have productive capacity to be graduated out of the program, and it is one of the initiatives that we'll be launching in the year 2015 as well. Our Director of Social Protection is actively working on that. So it's not, some people would unfortunately would have to be on, but some would be graduated, and the graduation would start next year. Thank you.
All right, thank you very much. One last question for all of you to run through. What advice would you want to give Ghanaian innovators out there and other innovators that are watching us via talk.unicef.org? Let's start with Pearl.
Yes. So I think we all know that we're operating in a very challenging environment, and there's several hurdles that we have to jump as innovators in order to make things work. We have taken it upon ourselves to constantly try new things. So every month we're coming out with something new to our product that's either an improvement, a bug fix, or we're going back and we're saying we've tried this and it hasn't worked. How can we improve it? So for example, in the beginning when we realized that there was a lot of messages that weren't going out because the person, maybe they didn't have reception, or they were out of coverage area, they were at work, or maybe their battery had died. we went back to the drawing table and we came up with a system where we have a retrial pattern. So, for example, if we send out a message and the person, gets a busy dial tone, or it goes to voicemail, or it doesn't pick up, we can actually automate that to try every hour or to try every 3 hours until we get through to that person with the message.
So you constantly keep testing and trying and improving.
Yes.
So that would be your advice to the innovators out there, to keep testing and trying their solutions and to keep improving.
Exactly.
Thank you very much. Samuel.
My advice to young innovators like me is the age-old advice, just being persistent, right? What do I mean? Yes, we are in a region with several challenges and problems, but of course these problems, when solved, translate into opportunities. Okay, but to be more specific, I'll tell young innovators to spend more time to understand the problem that they're trying to solve. From my development experience, oftentimes you build an idea, a crazy idea comes into your head, and all of a sudden you start putting things into the algorithm and then try to make something work. But then you roll it out into the market and you realize that it doesn't really solve the problem as you thought of it as. And so my advice will be for them to spend time to understand, does this problem really exist? Is it a pain for the intended users? Then they can go ahead to build the application and then roll it out to them. And so it's very important that they incorporate or they involve the intended users of the application even in the development life cycle.
Andy.
Yes, so maybe I should speak specifically to the African innovators. We have been sleeping for far too long. All these numerous challenges are erupting from Africa. So we should wake up. We always give so many excuses, but if elsewhere others were giving those excuses, they will never have gotten anywhere. So we have a lot of work to do. We should get together and network and see how we can solve our own problems and own our own projects. That's my advice to them.
Thank you very much. We've been sleeping for far too long.
My advice to innovators is that nothing good comes on silver platter. Persistence pays. So whatever challenges that confront you in your innovation process, just seek and you'll find the answer. Thank you very much.
Thank you very much, Jigbodi. I know there are many more questions from the audience, and there are many more questions coming from online, but unfortunately, our time has come to an end. Once again, I'd like to take this opportunity to thank our very own Susan Ngongi for being with us today, and Honorable Minister as well. We hope this active talk was innovative enough and it was engaging enough. And we thank those who joined us on the online platform as well for joining us for this program. Thank you to everybody for making it out of their busy schedules to join us here today. I would want to say goodbye, but I don't have the muscle to say the goodbye. So I would invite Clemens Gross from UNICEF. Clemens.
Thanks so much. Thanks all for you being here this afternoon. Thanks for watching. Bye-bye. Thank you.